Hello, AP students. This is Mrs. Politsky, and I have some notes for Chapter 6, Learning. And this is a continuation of our discussion on classical conditioning. And so today we're going to start with the notorious case of little Albert, which I'm sure all of you are familiar with. If you remember back to our intro chapter, we talked a little bit about John B. Watson. And in this case, his assistant, Rosalie Rayner, roughly 80 some odd years ago, did an experiment, a little bit like Pavlov's, where they, for the most part, were trying to see if they could condition an infant, in this case Albert, to fearfully react to a white lab rat. And they created the fear by repeatedly presenting the rat paired with some kind of aversive unconditioned stimulus. In this case, it was the sound of a steel bar being struck with a mallet. And it took only 7 trials for little Albert to react with fear at the appearance of just the rat or the conditioned stimulus alone. Watson and Rayner then showed that his fear readily generalized from a rat to other furry objects or white furry objects. And so they presented Albert with a Santa Claus mask and a white fur coat worn by Watson. And Albert, for the most part, reacted roughly the same as he did to the rat alone. The experiment caused Albert only temporary distress because his fear extinguished rapidly. Thus, the fear had to be strengthened. This needed to be reconditioned for Albert, or it threatened the whole experiment. And after 5 days, Watson and Rayner were attempting to show that the child's fear could be generalized to a dog, a rabbit, or a sealskin coat. Watson decided to freshen the reaction to the rat by then striking the steel bar. In this case, the experiment went awry, and the noise startled the dog, which began to bark at Albert, which only frightened Albert, but it also scared Watson and Rayner. And about this time, the experiment was deemed complete. Along with this idea of generalized stimulus and this idea of the whole concept of maybe spontaneous recovery, we're going to talk a little bit about how this might have been done in other scenarios. And one is that kind of came about was something that occurred after World War II. Experimenters talked with sailors who were exposed to the battle call for the stations, battle call for stations, and the sound was strongly associated with danger, and so the conditioned stimulus, for the most part, caused some kind of emotional arousal. Whenever the alarm would go off, soldiers would have a tendency to rush to their stations, and this persistent effect of learning was shown in a study conducted 15 years after the war, when Navy veterans who had experienced combat still gave a strong automatic reaction to the old call to battle stations. Another experimenter, Mary Cover Jones, in 1924, roughly about the same time as Watson and Rayner doing their little Albert study, also was interested in this idea of unconditioned fear, and she took a 2-year-old subject whose name was Peter, and sometimes we refer to him as Little Peter. And what we were trying to see is whether or not you could have the unconditioned fear towards a white rat or a rabbit. And through a series of sessions in which she increased the degrees of toleration, the fear began to decrease until at the end, Peter stated that he liked a rabbit. A good therapeutic strategy combines extinction of the conditioned fear response with learning a relaxation response to the conditioned stimulus. This is sometimes known as counter-conditioning therapy. that teaches patients to respond in a relaxed manner to a conditioned stimulus. Conditioned food aversions. The taste, smell, appearance of specific foods is strong enough to cause a feeling of nausea, especially if you've had a bad experience with any of these kind of foods. And learning to avoid foods associated with illness has always had some kind of survival value. So to find out whether or not this actually does work, John Garcia and his partner Robert Kohling first recognized the selective conditioned stimulus, unconditioned stimulus connection when they noticed that rats avoid drinking water from bottles that were in their chamber that had previously made them nauseated by radiation. In 1966, they found that the rats readily learned an association between the flavored water and the illness, and yet the rats could not be conditioned to associate flavored water with an electric shock. Some challenges to Pavlov's classical conditioning. You could talk about it in forms of taste aversion learning. This is a biological tendency in which an organism learns after a single experience to avoid food of a certain taste if eating it is followed by illness. Food aversions can develop even when the time interval between eating and illness extends over several hours, as compared to just a few seconds in Pavlov's experience. And on the subject of Garcia, Garcia again and his colleagues demonstrated how aversive conditioning can dissuade wild coyotes from attacking sheep. And researchers did this by wrapping toxic lamb burgers in sheepskins and stashing them on sheep ranches out in Wyoming. And when roaming coyotes found and ate these morsels, they became very sick and developed a distaste for lamb meat. This reduced sheep attacks by our coyotes from 30 to maybe 50%. The conditioning involved both nature and nurture. Conditioning depends not only on the learned relation among the stimuli and the response, but also on the way the organism genetically attuned to certain stimuli in the environment. Thank you very much.